There are 30 million people in our country currently or formerly suffering from heel pain. That's 10% of the US population. Currently, 2 million people are affected by heel pain. Number of visits to foot doctors per year, 1 million. And 44% of all visits to foot doctors are heel pain related.
Welcome to KimFoot.com. This is Dr. Kim. Do you have heel pain? Well, let's talk about heel pain today. Last 22 years of my private practice, I've seen literally thousands and thousands of patients with heel pain. I myself suffered heel pain for many years, on and off. So I developed my own ways of treating this problem, and I wanted to share that with you today. We're talking about two different locations of heel pain. First area is at the bottom of the heel, which is what we're going to talk about today. We call it plantar fasciitis. And there's a heel pain on the back of the heel. We call them Hageland's deformity, which is not as common, so we're not going to talk about that today. Now, when you talk about plantar fasciitis, plantar means the sole or the bottom. And fascia is a thick band of tissue. You see this blue structure going from the heel to the ball of the foot. That fascia becomes inflamed. We call them itis. Fasciitis. Itis means inflammation. Now, this thick band is inflamed. In addition to the thick band, there are 4 other structures that are also inflamed. There are muscles that are right underneath the fascia that are inflamed. We call them myositis. The covering of the bone, which is also inflamed, we call them periostitis. And then the bursa, which actually protects the heel bone from friction, also becomes inflamed. We call them bursitis. Also, there are a couple of nerves that are going right through the area, also become inflamed. We call them neuritis. Also, when this periosteum, or the covering of the bone, pulls away from the heel bone, it makes it bleed, and new bone forms. We call them heel spur. And why is this heel pain became an epidemic in this country? Over 30 million people are involved in this. Because of the chronic inflammation. When this area becomes inflamed, rather than just being inflamed, after a while, it becomes degenerated and start dying. We call this fasciosis, which means the degeneration or death of the cells. And this thick, scar-looking tissues start developing, and it's very difficult to treat and improve. Therefore, this became an epidemic in this country. In this video series, we're going to talk about 7 causes of heel pain epidemic, 4 main symptoms of the heel pain epidemic, 6 easy-to-follow home remedies that you can try first before you go see your doctor, and then 6 powerful foot doctor's remedies that your foot doctors will give you when you have to go see your doctor. And also 4 main ways to prevent this heel pain epidemic. Let's talk about the 7 causes of the heel pain epidemic that's making millions of Americans limping on the next video.